Hello and welcome to week 2 of short talks on gender, sexual and relationship diversity for adult learners. This week I'm going to focus on gender, names and pronouns, and I also promise that there are more slides within this 15-minute presentation than there were last week. Last week I introduced the concept of gender diversity, so this week I'd like to look more specifically at transgender identities, names and pronouns. Stonewall have suggested that around 1% of the UK population identify as transgender, although we have no robust data, so there is a call for gender identity to be included in the 2021 census. What we do know for sure is that the number of referrals to NHS gender identity clinics has exploded over the past decade, with the number of adults and children being referred to English gender identity clinics rising from 3,330 between 2014 and 2015 to 8,074 between 2018 and 2019. So an average year-on-year increase of around 25%. At Tavistock and Portman NHS Trust, the Children's Gender Identity Clinic, the year-on-year increase within the same time frame was 40%. And there's still no sign of this rate slowing down. So this rapid increase has overwhelmed the NHS clinics and created a national crisis that puts gender patients at great risk of mental health deterioration and suicide. Across the UK, we currently have 16 NHS gender identity clinics for adults, and then there are 4 NHS gender identity services that have various satellite clinics for young people. So England has 10 adult GICs and GIDS, which is the Gender Identity Development Service for under 17s. Scotland has 4 adult clinics. Wales has 1 adult clinic. Northern Ireland also has 1 adult clinic. And Scotland, Wales and Northern Ireland also each have access for under 17-year-olds. So the clinics that you just saw listed there all currently have waiting lists ranging from 2 years upwards, and some of the clinics aren't accepting new patients because the waiting lists had got so far beyond manageable. Many of the private gender clinics also have long waiting lists, and of course there are also people that identify as trans that will never seek treatment or intervention from a gender clinic at all. So we clearly have a significant demographic of transgender people in the UK and the rest of the world. And many of these people are in an extremely distressing position as the healthcare that they need in order to achieve gender comfort is not easily accessible. So what is gender comfort and how does one achieve it? Well, it is the common goal of all gender patients that transition. Transition is a process of embracing one's true gender identity and or pursuing changes to alleviate gender discomfort and come to a place in which gender comfort can be experienced. There's no set clinical pathway for patients identifying as men, women or non-binary, as it's individual what anybody might need to achieve gender comfort. For example, treatments might include counselling therapy, speech and voice coaching, facial hair removal, hormone therapies, genital or chest surgeries and so on. In my time as a counsellor at the GIC in Exeter, it was my job to support patients on their journey towards gender comfort and provide a safe space to explore and celebrate each patient's unique sense of self. Counselling is a very privileged position in which clients or patients trust the therapist with their innermost thoughts and feelings. And it's not like a normal social situation, as it's a protected space like no other. So that leads me to talk about what we all can do in everyday life that's helpful in promoting gender comfort and recognising gender diversity. Names and pronouns. It's a really simple courtesy, but with an important message about respect. Ask and use the pronouns and preferred name of the person or people you're communicating with. Of course, our communications can take many different forms, as it may be via email or on social media that you're chatting with somebody, or it could be in education or the workplace. It might be in a shop or a restaurant, and in such case, it might not feel so natural to check out pronouns for the person serving you your cup of coffee. This is why it's good practice for all of us to have our pronouns and preferred name visible in situations whereby we might not be introducing ourselves verbally or in writing. For example, work name badges. When we make this standard practice, it avoids slip-ups, misgendering or being misgendered, and stops us having to guess how we might refer to somebody. This practice is happening more and more across local authorities and statutory agencies that are clued up on diversity and inclusion in the workplace. I was pleasantly surprised recently when I joined a local library to be asked my pronouns and gender indicator by the librarian registering me, who was also wearing her name and pronouns on her ID badge. And she simply explained that it's their policy not to assume gender. Schools tend to be good at asking students what their preferred name is, so a nickname or chosen name can be used rather than a birth certificate or official name, which might not feel fitting to the individual for any number of reasons, including gender identity. So please note, we would not ask for preferred pronouns, as this is a finite marker. I wouldn't say my preferred pronouns were she, her, because that might suggest that I had other pronouns in the same way preferred name would indicate that there was an alternative name by which I was known. So in my case, my preferred names are Jenny or Jen. Officially I'm Jennifer, but never called this socially, and my pronouns are she, her. These are the ways in which I like to be referred, but they do not alone provide information about my gender identity, as there are plenty non-binary or genderqueer or male-identifying people who use she, her pronouns or a combination of neutral pronouns. So again, the all-important thing for us all to do is make no assumptions. It is impossible to judge based on appearance, presentation, name or pronouns how any one person might identify, even if you know that person well. This can be a deeply personal experience, and should anybody decide to confide in us about their gender identity, then we should feel honoured to be trusted with that information and not assume that this is problematic or any cause of concern. If we are to state our own preferred name and pronouns, it is also far more likely that the people we are in communication with shall also feel comfortable to do so, and depending on the context, may even open up a conversation about any other parts of their identity that they wish to share. So last week I mocked society for the unhelpful definition of what sex is. This week I'd like to point out how ridiculous it is that we gender public toilets and hospitality, education and workplace toilets. And binary gender at that. Where are non-binary people meant to go? And at what age is it inappropriate for children to use the wrong toilet rather than be accompanied by a parent where safety might be a concern, for example at night time in the city? This is really not inclusive and completely impractical. If you have gendered toilets where you work, perhaps you can influence change so that there are equal opportunities to use the loo. It does seem pretty bad we're in the year 2021 and we do not allow civilised access for this basic human need. For many people, gender labels are important, and there are lots and lots of them, which I find really interesting to look up. But I also always ask the person using the label for their definition or experience of that label, because that gives me clarity and tells me a lot more about the unique experience and identity of the person behind the label. I'll add a slide now with some labels that you can pause on if you like. For the most reliable and up-to-date information on gender identity research, the best place to look is gyrus.org.uk. This is the Gender Identity Research and Education Society, and I'll list this on the next slide along with some of the support agencies that you might contact for gender care, advocacy and advice. Please remember that you don't need to be an expert in gender diversity or transgender health to think about and have conversations about gender. It's such a fascinating topic, and we all have a unique gender identity to explore. It's important that we don't further marginalise people with trans or genderqueer identities by expecting them to educate us or asking unsolicited questions about their own identity. Again, this comes down to basic manners and respectful behaviour. For the vast majority of people who have gone through transition, this becomes part of their private medical history and they may not want to wear the trans label, but perhaps one of the other gender labels as they see fitting. But sharing of such information is dependent on context and relationship. So I'll leave you with some resources and thank you for joining me on week 2 of GSRD Short Talks on Gender, Names and Pronouns.